But for carpal tunnel syndrome, the main presenting symptoms that patients will always report will be obviously the onset of wrist pain. The hallmark of this will be numbness. You have numbness of these three fingers. There's pain over here and then there's numbness here. And if you ask patients if they wake up at night when they're asleep because of a feeling of numbness on the hands, then most of them will say that they do wake up because of this. Well, incidence-wise, no, it is one of the most common type of compressive neuropathies, no, meaning these are conditions wherein you have chronic compression of the nerves that pass through particularly the wrist and the hand for carpal tunnel syndrome. Risk-wise, no, we identify, or those that are more prone to it will be the female population. This is also very much seen in a lot of comorbid conditions like diabetes, thyroid, and we see this also even in pregnancy. This is mostly seen in the young adults. Most of the times, we see this in around the third to fourth decade of life. Most common cause din that we see will be those with occupational setting, in the occupational setting where you have repetitive and constant pressure over the carpal tunnel or repetitive movements of the wrist into your flexion and extension. So aside from those problems, you have your numbness, tingling sensation, and then you have the wrist pain. Later on, if this persists for a long time, it becomes chronic already, then you start developing problems with muscle and motor strength. Particularly for this muscle over here, you have weakness in pinch grip for the thumb. Like some patients will complain of clumsiness, of holding ball pens, holding keys, utensils. They drop coins or they have a hard time buttoning their shirt or unbuttoning their shirt. And the worst one is, at the last stage, then this muscle, it loses its bulk and becomes very flat. So there are patients who take more than 10 years before they progress to a severe form. And then there are patients who progress to severe stages even under 1 year. It depends on how frequent is it exposed to repetitive and constant pressure and constant motion of the wrist. As with other common conditions that we see in the hand, there is always a conservative or non-surgical option and then a surgical option. If we start with acute cases, meaning these are brand new cases, less than 3 months in duration, and the only symptom that the patient presents will be pain on the wrist and numbness of the finger or tingling sensation. If that is the case, we can offer some conservative options. The most significant of these will be wrist splinting. But the splinting has to be worn around 22 hours a day. If the patient is unable to wear this because patient is working or needs to use the hands, then we at least advocate for nighttime splinting. Another common conservative treatment option that we advise to patients will be to modify their lifestyle and their activity. But obviously, there are some restrictions because if patients work and they are using their hands, like those manual laborers. So aside from these non-pharmacologic options, we can offer, of course, medications. Basically, these are medicines that can relieve the inflammation of the nerve inside. And then afterwards, if these don't improve the patient's condition, we can offer injections, like steroid injections, again, just to relieve the inflammation and pain. And also, physical therapy can be done to help relieve the symptoms. So usually we give it around 3 months of a conservative option. If things do not improve in 3 months, then we can recommend surgery already. The carpal tunnel is just basically here at the base of the palm. And if your work or occupation exposes constant pressure to this part, then that's a risk. Another one is the position of the wrist. So the pressure inside the carpal tunnel increases if you are in the extreme end position. So if you are constantly doing this or doing this, these extreme end range positions can increase the carpal tunnel pressure. And of course, if you do that repetitively, then you are going to develop carpal tunnel syndrome. It's a very misnomer thing to always associate carpal tunnel syndrome with secretarial or clerical occupations. But even non-secretarial and clerical occupations, they do develop carpal tunnel syndrome. Those who regularly go to the gym, even in lifestyle activities and even in work that does not concern a lot of desk jobs. no? Most especially for manual laborers. Carpal tunnel syndrome does not develop because of just a one-time exposure for something that you do. It is a cumulative problem. So, if you constantly expose your hand and your wrist, no, to constant pressure and constant motion, then that is a problem. So, to take care of that, no, we must at least avoid, no, extreme ranges of motion for the wrist, avoid constant pressure over this area, no, and even avoid exposure to prolonged vibration in the palms, because that is also another risk factor for developing carpal tunnel syndrome.